testicular tissue, and we see whether there is no sperm at all, or there is low sperm, or there is good sperm and the sperm is not able to come out because the vas deferens, the connection between the testis and the outside, is blocked. So if there is whatever thing, if you find sperm, just take out the sperm and then freeze it, and then you can use it. Once you take out the sperm like this, no IUI is possible, only IVF or ICSI. So you do ICSI with these sperms, and then you get pregnancies to the tune of 65 to 70%. So even if you have no sperms, don't worry, there are still technologies to improve it. Now for some patients, if there are zero sperm, what do we do? So in these cases, like I described earlier, we can use the stem cell and the platelet rich plasma, and then you can inject it into these testes, and about 90 days later you check and see whether there are any sperms in the ejaculate. If it is not there in the semen, then you aspirate the testis once again and try to take out the sperms. Some patients have something called Sertoli only. That means there are no little cells which actually produce the sperm. So this is called Sertoli only syndrome. Initially, these patients were all asked to go only for donor sperm. But today, we have the stem cells which we take from the bone marrow, we concentrate, and then we have a technology called co-culture. So we take the cells from the testis and then we culture it along with the stem cells, and maybe after about 1 month or 6 weeks, then slowly the cells start growing, and when we see that they are growing, then we concentrate them and then we inject it back into the testis and see whether this is going to help the sperm production to increase. So we've done it in a few patients, and a couple of them have shown promising reports, and so now we are doing this to help more and more men with zero sperm count to have babies with their own sperms.
Okay, ma'am. Nowadays, many patients are complaining about many miscarriages. So what do they can deal with that? Okay.
Now, this is very important because, like you rightly said, there are a lot of patients who have miscarriages, and we have to do something for them. The first is we have to find out why the miscarriage happened. Is it a problem with the structure of the uterus? Is it a problem with antibodies developing? Is it a problem with some thickening of the blood which happens in these patients causing clots? Or is it some abnormality in the genetics, karyotyping, which causes in the chromosomes, which causes this sort of miscarriage? Or is it because of the poor sperm analysis which is the cause of this? So we do blood tests and we try to find out whether any of these problems exist. Sometimes uncontrolled diabetes also causes this. So we try to correct the blood glucose levels, and we do a hysterosalpingogram to tell us about the shape of the uterus, whether it is a good uterus or whether that uterus is double in structure, or whether the mouth of the uterus is open. So we try to find out why it is happening. We do a sperm analysis and we do a test called DNA fragmentation index, which tells you about the breakage of sperms, and when there's a high DNA fragmentation index, then that also causes miscarriages. So we have to look at that test as well. And sometimes infections can also cause, so we do check up for infections as well. So when we do all these tests and we identify causes, then before the next pregnancy, we give medicines like folic acid, and then we also give ecosprin, which is meant to improve the blood flow. And this is before, and if the patient is polycystic, we give metformin. If the patient is obese, then we try to reduce the weight. And for the man, we tell them no smoking, no alcohol, no coffee, and give them a lot of vitamins to decrease the DNA fragmentation index. So all this is done before we start the pregnancy. Now when we start the pregnancy, if there is any chromosome problem, then ICSI is very important. We have to take the eggs out, we have to inject the sperm into the egg, and with the laser we try to remove a few cells. We send it for genetic testing, and then the report will come back as recommended, not recommended. If it is recommended, there is no problem, you can transfer these embryos. But if it is not recommended, then there is some chromosome problem, and therefore we should not transfer these embryos back into the uterus. Now the next thing is how to improve the quality of the embryo. Now, normally we use a process called